All right, so now we're going to talk about measuring toxicity, and this is where you're going to actually do a lab along with it. So pay attention to how these graphs work. They're pretty straightforward, so I don't think you'll have too many issues. Just make sure you've got like the terminology correct and understand how to read it. Once you've done that, you should be good. All right, so scientists can determine the concentrations of chemicals that harm organisms. And to do this, they look at a dose response. So the dose response study is a study that, I kind of skipped around, that exposes animals to different amounts of a chemical and then observes a variety of possible responses. You could observe for mortality, as we see in this example here. This is looking at the percent of the population killed by the dose. Or you could look at like changes in behavior, changes in reproduction. You can also do this for a drug, and instead of doing the like LD50, which is the least lethal dose that would kill them, you can do ED50, the effective dose, so the dose that gives an effect. So this is how they get like the dosages that you see on the back of a medication bottle. So the dose response curve is this curve you see here. So we're looking at what the dose is on the x-axis down here. In hypothetical units, this is just some made-up thing to do a curve, and then the percent of the population killed by a given dose. So to find what dose is the LD50, so that's where 50% of the individuals are killed, you go over from 50% until you hit the curve that you have plotted, and you go down and find what the dose would be. An acute study is an experiment that exposes organisms to an environmental hazard for a short duration. Typically, this is like a higher dose would be at the top during an acute study. A chronic study might do lower doses, but over long term, so to a hazard for a long time. Sublethal effects. This is the effect of an environmental hazard that's not lethal, but can impair the organism's behavior, physiology, its reproduction rate. And so this is all lumped under the group of ED50, effective dose. So the effective dose of a chemical that causes half of the people to display some effect. So it could be a harmful but non-lethal effect, as is the case with most of the way these studies are done on environmental like toxins. Or like I said, you could do this to see what dose of a medication is effective in treating a condition. So it doesn't have to be harmful. It's just that most of the time when we use it in environmental science, we're talking about something that's harmful. A retrospective study is where we monitor people who have been exposed to an environmental hazard in the past. We will not do a prospective study, typically on people, in which we would purposefully expose them. So retrospective studies are usually the best things we have because they look at people who've been exposed in the past and how their health is different from people who were unexposed. A prospective study would monitor people who might become exposed. Typically, the people who might become exposed, the prospective study kind of areas are going to be limited to people who are choosing to like do something. So for instance, you might do a prospective study on how does life in space at the ISS affect muscle physiology. The person who is part of that study is choosing to be an astronaut and go live on the ISS. Typically, we are not going to have a company saying, hey, we're planning on polluting here. Let's do a prospective study looking at kids and see how healthy they are now and then look at them in 6 years after we've been polluting. That would be unethical. All right, a synergistic interaction is a situation in which two risks together cause more harm than expected based on separate effects of each risk alone. Now, I read that definition kind of because it's there and that's just what you do, but I want to explain this to make sure that you understand this. So this is where you have two different risks that together cause more harm than you might expect them if you were just adding the risk. For example, if someone is a smoker and they also drink alcohol, for example, you might see more risk on their heart health because they are combining both of those risky behaviors than you would if they did just one or just the other, or if you added the risks up. So just to give an example, like if our risk, and I'm just going to use simple numbers so that we can understand. If our risk that we got from smoking was 2 and our risk from drinking excessive amounts of alcohol is 2, you would expect that doing both, you would have a risk level of 4. But in a synergistic interaction, you would have a risk level of maybe 5 or 6. So you're getting more harm than you would have expected. You can also have things that have antagonistic interactions. So this happens a lot of times with like different drugs. If you take 2 drugs at the same time, one of them may not work properly. You'll see this on a lot of different medications. There are certain types of antibiotics. Ceftonir is one because my daughter was just on it for an ear infection. And ceftonir you are not supposed to take if you take anything that has iron, because the iron can actually stop the functioning of ceftonir. So her dose of ceftonir was a once-a-day dose, and we gave it to her at dinner because I noticed that almost all of her favorite breakfast choices, granola bars, cereal, things like that, have added iron. And iron is not good with it, or some other cations like calcium, which are in her other favorite breakfast foods, yogurt. So because of that, because the medication doesn't work as well when you're eating those things, we gave it to her at the end of the day when she was less likely to eat some of those like foods that have added iron in it. And that would be an antagonistic effect because the iron is antagonistic to the ceftonir. It's causing the ceftonir to not work properly. Toxicity levels, typically we consider something moderate if you would have to have 1 gram per kilogram of body weight. Very toxic if it's 10% of that moderate, so 10%, which means smaller doses, is very toxic. And then extremely toxic would be 1% of that moderate dosage level. Super toxic is lethal at doses of a few micrograms. So something that is super toxic is one of those things that is like, touted as the most toxic substance on earth. Blue-ringed octopus stings or something like that. Or fugu, the pufferfish, has compounds in it that are very lethal at very, very small doses. There are other things that have been used. Polonium, I think, was the thing that the Russian spies allegedly used to kill people or something. I don't know. But there's some of these that are considered super toxic because they're lethal at such small doses. All right, acute versus chronic effects. And I know I'm just going through a bunch of definitions. We're going to stop in just a second because we're going to finish with the qualitative risk assessment in its own video. But first, acute versus chronic. An acute effect is single exposure, results in immediate problems, short term. Chronic is long-lasting effects, could be permanent. From one dose or from repeated exposures, or it can just cause long-lasting effects. For example, you can have acute bronchitis where you might be sick for a couple of weeks to a month, or chronic bronchitis where you might be sick for many months and need to take many months worth of, lung treatments and steroids. All right, that is it for this video.